Academic health science networks, or health innovation networks as we will soon be, are uniquely placed to help drive digital transformation across the health and social care system. We work with some brilliant organisations, including Sussex Community NHS Foundation Trust, who you're going to hear from today. Innovation adoption and transformation is really difficult and so often driven by passionate clinicians and teams who are unable to make changes, unable to make improvements, and ultimately help improve care for patients.
So the Clinical Digital Innovators Programme is so important for us in what we're trying to do here in Sussex Community. Fundamentally, the NHS has got some serious challenges that it needs to face in terms of ageing population, increasing demand on our services, and the role that digital can play to sort of help address that, I believe, comes very much through a proactive and curious attempt to try to get the maximum benefit out of innovations across all of our work.
We decided to run a course at SCFT for digital clinical innovators because we could see that there was a need for something that wasn't just the national courses that are available, because there's not space for everybody to be on the national courses, but there's a real need for us to offer that opportunity for people locally to give them the skills that they need to lead digital change, to make sure that clinical people are leading rather than all of the instructions coming from IT teams, so that we can really make sure that patients get what they need from the projects we're doing.
I think the clinicians add real benefit to the digital agenda. So what our clinicians will do is make sure that we keep the patients at the centre of what we're doing, and they can make sure we consider clinical safety as well, and manage any of the clinical risks that may arise. And I think what's also important is that they can lead evaluation and make sure that we think about what the impact of any digital technology has been, both on the patient experience and on patient outcomes as well.
I think it's really important for clinicians to be involved in digital change and to even take the lead. I think, you know, we've got our view of how things should be and how things could be improved, but really it needs to be them who tell us what they need and what can make their working lives better, and ultimately what can make their patient care better.
If you had said to me 5 years ago that as a clinician I'll be working digitally or be involved in a digital program, I would have told you no way, that is not possible. But as we've all lived through COVID brought about some really interesting changes, and one of those was clinicians learning to work digitally. That's when my interest in becoming a digital clinician came about. During COVID, we worked on a project supporting care homes, and it was just that acceleration, that speed with supporting care homes with digital technology that just sparked a really deep interest for me. So hence why I signed up to be part of the Digital Innovators Programme.
The Clinical Digital Innovators Programme has been amazing. It's been really inspiring, and it's come at the right time. Following COVID, it's been really difficult working in healthcare, and this has been a breath of fresh air. The Trust are really engaged in data and innovation and are looking to lead forward on it. And it's been amazing to work with the colleagues across the Trust in different specialities who are implementing their projects in different ways.
So I think one of my favourite things about the programme has been the speakers that we've had. I think they've been really inspirational, a lot of them, and I think that they've allowed all of us to see that we need to be the drivers of change. If we're the ones with the ideas, we need to push them forward rather than relying on other people and other systems in place to make those changes. So it's been really nice to have those sort of inspirational discussions.
I think it's really opened my eyes to the digital platform and how we have to use it going forward. There's not going to be any options in, we can't sustain the current level with the current amount of staff. So we've got to do something different, and digital has got some really good options for that. So I think looking at how we can use digital technology more effectively is a really exciting avenue. The exciting thing about digital is that it is a way to transform services that might have less financial costs than getting more staff, and it's something we really need to embrace and stop being afraid of, because I can't see many other ways out at this point in time for where we are.
The digital future of the NHS has patients at its heart. We have better ways to listen to what they need and what they want. Clinicians are going to be crucial to that because they're going to be the ones who are the eyes and ears of the NHS. We'll have patients in better control of their healthcare because digital systems will enable that. Our workforce will all be digital. There won't be a separate digital workforce. We'll have all of our workforce enabled with the skills that they need. We've got a while to go before we get there, but we understand much better what we need, so we'll be moving in the right direction.